Dog walking is one of the best parts of having a dog. Fresh air, exercise, well, but it can be a drag if you have to drag your dog just to keep moving. You know, they have to stop and sniff and take a whiz. And you and I, we just want to maintain that brisk pace, don't we? Well, we can actually negotiate this. And by the way, in case I haven't met you folks, I'm Dr. Jeff Nickel. I'm a residency-trained veterinary behaviorist with many years of experience in general medicine with everything from cancer to internal medicine, fractures, you know, the whole thing. So if you have any questions, it doesn't have to be confined to behavior of dogs and cats too, but any physical issues, this is a good time to get some information. And so I want to ask, anybody wants to chime in and tell me about some of the challenges they've had walking their dog and, you know, getting everybody's needs met, because, you know, you're the leader and your dog is supposed to be your subordinate, and so why are you dancing to your dog's tune, right? Well, let's talk about that. I like to read these questions I get from my newspaper column that it's in the Albuquerque Journal on Friday mornings. And this one in particular, I titled, of course my editor puts the headlines on, I don't get that job, but I titled them myself anyway, and this one I called Stop, Sniff, Stop, Pee, Repeat. Okay, that's the way it goes, right? Okay, here's the question. My nephew and I both have large male dogs. I told him that when I take our 100-pound black Labrador for a walk, he sniffs, browses, and marks his territory. My nephew indicated that letting males do so shortens their lifespan since they're under duress while doing it. I would think that holding them back, fighting the urge to go, would be more of a negative effect than the natural urge to go sniff and mark things. He's right, actually. So here's my answer. There is plenty of misinformation on canine behavior, often involving the frustration people feel with their male dog's incessant sniffing, urine tagging, and, you know, general dilly-dallying. This is emblematic of many of the ridiculous struggles in today's world, isn't it? All of us have quirks that might be annoying but could instead be regarded as just interesting. Well, your point is well taken. Dogs are highly social creatures who absolutely must get off territory at least a couple of times a day. They need to read the bulletin boards and post a few messages of their own. Dogs are a highly social species, and in fact, it's a social experience for a dog to get out there and sniff and investigate and leave messages, even if they don't encounter another dog. In fact, there are some dogs who don't do well with other dogs, and they still need to get off territory. A big yard isn't enough. Okay? So, more than just marking and leaving a scent, research has shown that has made us aware, of specialized glands between their foot pads that secrete a pheromone-like substance. These semiochemicals communicate messages for the next dog who comes along, sort of like a canine underground. Who knows what evil lurks? Revolution? I don't think so. So, the human on the other end of the leash has legitimate needs too, like enjoying an uninterrupted, brisk walk. I advise devoting the first portion of each stroll to your dog's needs and the second half to yours. Make it predictable by switching from canine to human priority at the same spot each time. After many repetitions, your dog will associate this waypoint with his requirement to defer to you and simply follow. Oh, look, who's visiting? Oh, Martha. Thank you for checking in. I'm glad you're here. I hope this is helpful to you. And by the way, if anybody wants to share this with someone who needs this information for their dog, just type that person's name in the comment line. This would be a good time for the heel command. You know, when your dog's just following you on the way home, and you're in charge, and you're getting after it and doing your power walk. By allowing your lab to have his needs met first, he'll be more relaxed and compliant during your portion of the outing. Don't forget that what gets rewarded gets repeated. Catch him doing something right. Tell him he's good when he behaves well, and give him a pat on the head often. And we tend to forget that, don't we? Not just with our pets, but with the people in our lives, our spouse or our partner, our children, our friends, people at work. You know, we all need to know that we've done something that's valued by others, because that brings value to us. And there are so many important similarities between the social model of dogs and their people that works for people too, and it works for dogs. And so if you've got a dog who's saying, oh, shucks, my part of the walk is over, and now I have to pass all these other opportunities to stop and sniff and urinate, they can be reinforced by their person for, no, you're doing the right thing. And the dog, again, got their needs met first, more relaxed for the second part of the walk. And it takes time, but your dog can certainly get accustomed to this. I don't know if anybody's ever tried anything like that, or if they found that they need any extra advice on this kind of thing, because there are other tools that we can put into this thing. Now, what about these dogs who stop like all the time, and have got to sniff and urinate and urinate and urinate, right? Well, neutering can make a difference with this. And so I have a research paper. I wanted to highlight just a few points. Let me show you this. This is from a journal called, let me see if I can get the color a little better here. I don't know, maybe not. There we go. I'm going to turn the camera around. This is the effects of gonadectomy on scent marking behavior. And then, of course, they do a cohort of shelter dogs in this case, because, you know, they were easy to get a hold of because that's where they are. Gonadectomy, of course, means removal of gonads, which is spaying or neutering. Okay? And I'm not going to bore you by reading this whole thing, but the study found that the medical term really is, well, one medical term is castrate, or neutered males urinated at lower rates than intact males. These are unneutered. They urinated at lower rates, in other words, less often, and that spayed females and intact or unspayed females urinated at similar rates. So in other words, if you have a female dog like Miss America here, and she is spayed, but whether she's spayed or not, the frequency of her urinating on a leash walk isn't going to be affected by spaying, but a male dog it typically is. Neutering did not influence the likelihood of ground scratching by either males or females. You know, after they urinate or defecate, they do this thing. Neutering had no influence on that for either sex. However, intact males, unneutered, were more likely to defecate on leash walks than neutered males. Rates of urination decreased after neutering in males, but did not significantly change after spaying in females. And the percentage of decreases in the average rate of urination after neutering ranged from 14 to 72%. I mean, this is statistical studies. And, you know, doesn't eliminate it completely. And if your dog was at the lower end of the scale and you had him neutered and he urinated less often, thank you, Carolyn. And by the way, if you want to hand me those little cat feeders, thank you. You know, 14%, you really wouldn't even notice it. But if your dog, if you neutered him and he urinated, stopped, sniff, urinate, stop, sniff, urinate, 72% less, then you would. Here you go, Tony. This is for you, baby. Gaston, you can have this one. There we go. Good boys. Here, Tony T. There you go. Yeah, get over there and enjoy that. Here, I'm going to put this over here. There we go. You'd notice a 72% decrease, wouldn't you? So, you know, everybody's individual. It's simply not going to be the same in every case. Has anybody here had experience with, you know, neutering making a difference? It certainly does. And, you know, it's not a sexual behavior, but it is a male-related behavior. It's what they call sexually dimorphic. In other words, behaviors that are far more commonly seen in one sex than the other. It's hard to find anything that's, you know, absolute. But anyway, so neutering. Here's another thing. Historically, we've recommended neutering dogs and cats at around 6 months, 8 months of age. Back in the day, when I was just a small veterinarian, just graduating from veterinary school, the conventional wisdom was that dogs and cats should be allowed to have a litter before being spayed, and that was debunked, or at least we thought so, because, hey, there's an overpopulation of pets. What the heck are we doing generating more? There's no need to let that happen. And so we would go ahead and neuter these pets before, spay dogs and cats before they came into heat the first time. So, around 6 months. And the males at about the same time, so that we didn't get into this, urine marking nonsense and tendency for aggression towards other male dogs, that kind of thing. Well, more research turns out not quite that simple. And here's another paper. This one, I'll show you, is from a journal called Reference Point, and this is determining the optimal age for gonadectomy, removal of the gonads, or spaying and neutering of dogs and cats. Okay? And let me just read you a couple of brief passages on this that I think you'll just find interesting. It's a pretty long paper, actually. But neutered dogs are at increased risk. This is male dogs. Neutered dogs are at increased risk of developing prostate malignancy. We thought it was the other way around. Now, this is not common in male dogs, but we found that the risk increases from 2.4 to 4.3 times as many in dogs who are never neutered. And it typically average age is 10 years, give or take a little, of course. So is that a reason not to neuter? Well, there are other benefits, and that's why you have to look at everything before you make that decision. Other types of tumors, obviously if a dog's neutered, he's not going to get cancer of the testicles, that kind of stuff. But dogs and cats who've been spayed or neutered have a risk for developing a malignant bladder tumor that's 2 to 4 times that of pets who were never spayed or neutered. Now, bladder cancer is almost always malignant in dogs and cats. Oh, look, somebody else showed up with a question. Oh, Trilla, I thank you for coming. I responded to an email that Trilla sent me only, 20 minutes ago, Trilla? So let me see what year. Oops. I often have a little bit of trouble getting this darn. There she is. Covey got expelled from daycare, and he can't come back until he's neutered. Covey is their dog, very sweet dog. And there we go. Let me see if I can bring this darn thing up. There we go. He is mounting and bothering the other dogs, which started attacking him. Now that's a very interesting, it's not very interesting for you really. It'll be interesting to look back on it after we've neutered Covey, because this little guy is being pretty normal, and mounting is certainly, obviously, a sexual behavior, but in many contexts, it is a communication among dogs. That's a little different than a handshake between us, but it is often an indicator that one dog is trying to be higher status than the other and to communicate that to other dogs. On the other hand, sometimes dogs, if they get nervous, they will mount as what we call a displacement behavior because they can't seem to get the heck out of the situation that they're in. They have to do something, and for some dogs, it's actually mounting. So, Trilla, I definitely encourage you to have Covey neutered. I'd offer to do it for you myself, but several years ago when I finished my behavior residency, I changed my practice to entirely behavior disorders, and I don't do surgery anymore. But any general practicing veterinarian can do it for you. Now, here's the but. If Covey stops mounting quickly after he's been neutered, usually only takes a few days for the male hormones to diminish, then we'll look back and say, well, it's just male related. We're not going to worry about it. He doesn't do that stuff anymore. But he's annoying some of these other dogs, and some of them are saying, look, kid, and he is just a kid, I'm not tolerating that nonsense from you, boy. I'll slap you into next week, right? Well, we don't want that. So by all means, let's get that little guy neutered. But if he still does it several days or longer after neutering, then we're going to look at that as a behavioral manifestation not directly related to his male hormone levels. So we'll work with it and see what happens. Interestingly, neutering in large breed dogs raises the risk of osteosarcoma, which is a malignant bone cancer. Not rare in large breed dogs. We don't see it every week, but it's angry and it's aggressive, and they are horribly painful. And frankly, by the time the symptoms show up, we can only slow the problem down. We don't cure it unless we were to recognize it way earlier than the dog shows signs. It can be seen in smaller dogs, but it's almost exclusively a large breed malignancy. And neutering actually raises the risk of that from 1.3 to 2 times. Is that a lot? Well, it's pretty uncommon anyway. So if you have a large breed dog, would you necessarily not neuter him? Yeah, it's something to consider, really. You know, you don't have to feel that neutering and spaying every single dog is essential. Cardiac and splenic hemangiosarcoma. It's a malignancy of the blood vessels, which is typically seen in the spleen, again, a large breed malignancy, almost exclusively, which can also show up in the heart. These things can tear and cause a dog to bleed out. They can be pretty horrible, although I've done surgery on a lot of these and removed them, and then followed with chemotherapy. In fact, my own dog, my wonderful, wonderful Airedale, Juan Gomez, you can see he was my backpacking partner among many things. This dog was just an absolutely outstanding part of my life. He was about 12 or so when he developed hemangiosarcoma of his spleen, and we removed that and treated him with chemotherapy, and he got more good time. But it did spell his end. It damaged his heart, and he died of heart failure. Boy, you never really get over these losses, do you? God. I mean, it's been, God, Juan passed away, Carolyn, back in 96. Wow. 24 years. Miss him still. So, another study in dogs who had been spayed or neutered at under 5 months, they had a significantly increased risk of hip dysplasia, another large breed problem. Certainly can be seen in smaller dogs, but it's almost exclusively a large breed problem. And it isn't that you shouldn't spay those to reduce the risk of hip dysplasia. Thank you for the heart, by the way, in these large dogs. Not a reason not to spay or neuter, but don't do it young. We see in a lot of shelters that they're doing this in young puppies, 6, 8, 10 weeks of age. And when you look at the broad stroke of that, they do it at that age because so many people don't come back to have it done. They might even leave a significant deposit, $50 or more, and they don't come back for it. So these shelters are spaying and neutering these puppies to make sure it gets done to stay ahead of the pet overpopulation problem. But there's risks on the other side of that. So, you know, we look at every case as an individual is really the takeaway from that. Anterior cruciate ligament ruptures, ACLs, like football players can get, a lot of other creatures, is more prevalent in spayed female and male dogs than it is in those who are not spayed. Orthopedic problem. But we found that if we wait until they're older to spay or neuter them, frankly, after they've had their first heat cycle, certainly with these orthopedic issues like hip dysplasia and ACL, the risk of those injuries, we tend to like to wait until their bones are fully grown. And what are called the physes, the growth plates that finally finish the bone growth. Sometimes in these giant breeds, it can be 24 months, sometimes a little older, before they are 100% grown. Most large breed dogs are fully grown 18, 20 months. Medium-sized dogs, like a Border Collie, like Miss America here, typically fully grown by 12 months, 14. And so we're now spaying dogs a little bit older. We recommend that just to reduce the risk of some of these orthopedic problems. When this girl was 6 months old, we didn't have this information because she's 13 now, and I spayed her when she was 6 months. And then when she was about a year and a half, she developed a shoulder lesion called osteochondritis dissecans. Would we have reduced that risk had I waited until her bones were fully grown? Maybe. Going forward, I'm going to do things differently. I recommend things because we have new information. Okay. Now on the other side, spayed or neutered dogs have a greater risk of becoming overweight or obese. So interestingly, if we spay them young, under 5 months of age, there's a lesser risk of becoming overweight or obese. Spayed female dogs are at increased risk of bladder infections because when they're spayed, their vulva shrinks a bit, and so urine can get retained. because the anatomy isn't quite the way the maker intended it. You know, the truth is that we were born with this anatomy. We're fooling Mother Nature by removing it. So the last one I wanted to mention here was that unneutered dogs, male dogs who had never been neutered, over 63% of them developed benign prostatic hypertrophy. The prostate gland gets enlarged, not cancerous, but enlarged, common in men as well, middle-aged and older men, and the same is true with male dogs. And if we neuter them, doesn't happen. So, yeah, what's the right decision? Well, number one, don't do it too early. And number two, it depends on what you want and what the size of your dog. And these are important questions to discuss with your general veterinarian. And they ought to be knowledgeable in most of these things so they can talk with you about that. So, back to these dogs who are urinating on leash walks. If you take the time to bring out the best in your dog, to build a foundation of choice and freedom and trust before asking your dog to do things differently for you, do that. Because if we try to require them to do things only for us, and there's nothing in it for them, they can become obstinate. And now we're butting heads with man's and women's best friend. There's no need to do that, but this requires empathy on our part, which is kind of a different brand of empathy than what we show people. Because it's one thing to walk a mile in someone else's shoes. It's pretty challenging if they've done something to offend you, isn't it? But it can be even more important then, because when people are kind of miserable, they say and do things that maybe they wouldn't otherwise, and they need our kindness and our empathy. But empathy towards a dog or a cat, that's even harder in some respects, because they have a lot of parts of their social model that are very much in sync with ours, which is what makes them such great pets. But there are some important differences too. Like, for example, if you go take a walk with somebody in your family, one of your human family members or friends, it's not likely that that person is going to stop and sniff and urinate often. At least, wouldn't expect that, would you? But if your dog does that, you say, well, it's a dog, right? But they have needs. They are highly social, and they have to read those bulletin boards and leave messages. And so we need to let them get their needs met and build that foundation of trust and choice and freedom. And then, at some point, and again, consistency matters, if it's the same waypoint during your leash walk where you say, okay, my turn now, and you turn around and go back the other way, or take, whatever the other part of your loop walk is, now it's my turn, and your dog follows you. And reinforce your dog for following and healing. I carry a treat bag. I give Miss America little treats. I use my target stick and my clicker to give her an opportunity to earn those good things and get that immediate reinforcer. And so I do it her way for part of it, and she does it my way for the rest of it. Who, by the way, this dog, I want you to know, hikes her leg to urinate. And you think, wait a minute, this is a female dog, right? I know you're a female dog. I spayed you myself. Why does she do that? Well, here's a fun fact for you, a little dog trivia, is that in the uterus, if this little girl puppy had her womb mate, her litter mate right next to her for the 63 days of gestation in her mother's uterus, and her womb mate right next door was a male puppy, his production of testosterone, the male hormone, actually diffuses through the placenta, and she gets exposed to it. So she's got some of these male characteristics, like hiking her leg to urinate. She also, I call her Miss America, as you know. Will you sit up with me so people can see you? Well, sit up for your daddy. Oh, you're so silly. There you go. That way people can see how cute you are. But when she did agility work with my wife, she was not Miss Congeniality with the other dogs. She would never got into a fight, but she certainly threatened. Male-related competitive behavior? Maybe. If her womb mate had been another girl puppy, she might have been more like Miss Congeniality. But we accept that about her, and we make allowances because she's mighty close to perfect. But, hey, who is really, right? Does anybody else have a question? Let me see if there's anything else. I think Trilla and Martha Thank you guys for coming so much. And if anybody else has a question, by all means, send it to me on my Facebook page. And if you have friends who need that kind of help, I'm always happy to give some advice. And by the way, next week, typically, as you know, I do these things on Thursday evenings. But next Thursday is Thanksgiving. And we're going to social distance, aren't we? We're going to make a sacrifice this year for everybody's well-being and not have family gatherings. It's going to be tough. But on Monday morning at 10 o'clock Mountain Time, I'm going to be doing a webinar for a CC Animal Health, mostly for pet parents. People can participate and ask questions. And the title of it is, let me remember the title, and it is Children and Turkeys and Grown-Ups, Oh My! And it's all about the stresses that dogs can endure and react to when there's a lot of new and different things going on in the home, and how to spot the indicators that your dog may be nervous, ways of improving your dog's well-being so he or she can relax. But also there are some dogs that when they get anxious and agitated, and especially with little kids, they can become defensive aggressive. We want to avoid that. So I'll give you some tips on all of this stuff, and if your dog has a long-standing anxiety problem, such as separation anxiety, there's a wonderful new treatment that's a non-medication, non-prescription treatment. And we'll talk about that too. It'll be about a 35-minute webinar, time at the end for questions. But if you can't tune in live at 10 o'clock Monday morning, and I'll put the address for this thing on my website, or on my Facebook page. So just go to my Facebook and you can get invited. It's no cost. And then if you, but on the other hand, if you miss it, it'll be on my Facebook page. You can check it out later. So that'll be my Facebook Live for next week. I won't have one Thursday night, and then we'll have one the next Thursday. So thanks for joining me and spending a little time with me. I do these things because I try to bring out the best in pets and their people. They're mighty important to us, and we can improve not only our relationships with these little rascals and deal with some of their behavioral issues and sometimes their behavior disorders in a pretty serious way, and we can get through most of these things. But we have to catch them early, and we need to be empathic, and we need to get good advice. So I'll help you in any way I can. And by the way, if you want to get these Facebook Lives in my weekly newspaper column that shows up in the Albuquerque Journal on Friday mornings, in the digital world we call that the media blog, those show up in the email inbox of all my subscribers every Tuesday morning. All you have to do to subscribe is to go to my website, drjeffnicol.com. That's drjeff, Nichol.com. And at the bottom of the homepage, you can subscribe. And of course, that's free too. Just put your email address in there, and we'll send this to you every Tuesday morning. And when you do subscribe, I will send you at no cost. Everything seems free, doesn't it? Not everything, but everything about this stuff is. My free at-home pet first aid and CPR guide, which is worth printing out and keeping handy because it's bullet-pointed, what to look for, what to do it now. Pretty handy, can save your pet's life if something comes up. So thanks again for tuning in, and I hope everybody stays safe and healthy, and please wear a mask. I'm talking to an iPhone right now, so I don't need to wear a mask, and I'm not worried about my pets. But otherwise, I'm wearing a mask. So please stay healthy. I want to see everybody every week. Thanks.